Hello everyone, this is the general feedback regarding the station on sterilization reversal. In this particular task, let's go to the task first. Here you are an ST5 and you have a patient named Kelly. She is 35-year-old and she is para 4 live 4. She is here to get a sterilization reversal done. On top of that, she is angry and upset about sterilization which was done for her. She wants another child, so she is here for a reversal surgery. So this is the task and all her previous sections were LSES. Now this task focuses on two key aspects. One is to diffuse the anger of the patient, and the second thing is to address her regarding the reversal of sterilization and to form a safe and acceptable management plan for her without hurting her feelings. So here, diffusing anger and being sensitive to the patient are important things. There are a lot of things which you have to cover in this task in a stipulated time because you need to talk about a lot of things here. I'll make it easy for you. So firstly, start your station with empathy. After confirming the patient's name and identity, tell that you are sorry. How can you start it? I'm so sorry, Mrs. Kelly, that you are feeling this way. Usually in our hospital, before doing any procedure, we take proper consent from the patient after explaining the procedure in detail. But as you are feeling this way, we'll definitely take it very seriously and I'll also inform my consultant regarding the same and we'll see what best can be done for you. I'm really sorry again for what has been happened to you. Kelly, are there any particular concerns or expectations from today's consultation? Yes, doctor, I'm really upset with the sterilization done to me as I've told you earlier, and I wanted to get a reversal done. I wanted to have a reversal surgery as soon as possible, doctor. I can see that you wanted to have a reversal. I'll definitely address all your concerns in a while. But before that, is that okay if I ask you a couple of questions, Mrs. Kelly? Okay, go ahead. So, first ask with an open question. So, you have already asked about concerns and expectations. Now ask why she wants to get a reversal surgery done, which is a most important question in the information gathering. She might tell you some reason like I have 4 kids, I want to have another kid or something. First of all, appreciate her for being a good mother and taking care of her children. I really appreciate you for taking care of the children at home. Do you need any support? Or are you getting adequate support from the family? Because now you see here she is a mother of 4 children. So you are appreciating her and inquiring about the support, which is a good way to start the station because it builds the rapport with an angry patient, which helps you to diffuse the anger. Now dwell into the task. Ask about the details like why she wants to get the reversal done, when was the procedure done actually to her, how was her recovery after the procedure. And now talk about rest of the history. Like regarding her periods, how are her periods, and about the previous obstetric history, any complications during the previous surgeries, her medical surgical comorbidities, allergies, and rest of the history you will ask as routinely. Okay, and in this information gathering, the two important things which you should focus on are about the partner history and also about the mental history. Why the partner history is important? Because here you are talking, here she wants to get pregnant and want to have a reversal surgery. So you have to make sure her partner history is important. And also her mental history, because she is a mom of 4 kids. On top of that, she is upset with the procedure we have done to her. So inquire about her mental history. Are you feeling down, depressed in the recent times? Yes. Now going into the task. So in this particular task, there are few headings which I'll tell you so that it will be easy for you to remember and you won't miss any points. First, talk about the procedure which was done to her, sterilization, and what are we going to do in the reversal. And about the success of the reversal surgery, the advantages and the disadvantages. So once you completely talk about the reversal, now take her through the effective alternate methods. Why you are bothered about the reversal surgery and why you don't want to have a reversal surgery for her, so that you are negotiating her. And then talk about other options by which she can get pregnant. And lastly, one important safety point is there which I'll be telling you now. So talk about reversal. How to talk about reversal? So this is a surgery where draw and explain. Whenever you're talking about these kind of complex things, draw and explain so that it will be easy for the patient to understand, and it will also create a good impression from the examiner. Always, whenever you get the opportunity, draw and explain. So these are the tubes. In this surgery, we do it via keyhole procedure where we join these tubes together so that there will be continuity and can get pregnant. Don't say you will get pregnant, because use the term that she can get pregnant. Okay, and now this surgery can be done by keyhole procedure. Usually the success rate of this reversal depends upon various factors like the age, type of sterilization done to you, and also regarding the length of the tube available. And what is one important thing which you have to do even before the procedure? You have to evaluate her with proper infertility investigations. You have to check her ovarian reserve, her tube test to know about the length of the tube, and also about the partner's semen analysis. These are the important investigations which you have to do before the sterilization procedure. Got it? Now talk about the advantages of the procedure. So with the procedure, there is a chance that you can get pregnant again. Remember, don't say that she will get pregnant again compulsorily, because there is a chance, there is a possibility only. This is important. No false reassurance or false hope to the patient. Now talk about the disadvantages, like why you don't want to have a reversal surgery for her. Yes, it is a surgery, but with any surgery, as there are some complications of the surgery as well as the anesthesia, like injury to your waterworks or to the bowel, and the anesthesia complications can occur. Considering your previous 4 cesarean sections, this risk will be slightly even more higher. Are you with me so far? And not only that, even after the reversal, it won't guarantee you that you will get pregnant. So you are telling her the facts properly, that reversal does not guarantee pregnancy. Okay? Now talk about other options for her. What could be the other options? You can talk about age related changes which can occur with the pregnancy, and also about the various alternative options which we can do, like going for an IVF or adoption. All these things you can talk about to the patient. Now what about funding? Doctor, in case if I get reversal done, and also regarding the next pregnancy, will I be able to get the funding? Usually for the reversal procedure, funding won't be provided. But considering your special situation, we'll talk with the GP and the clinical governing boards and will guide you regarding it further. So don't be blunt with the patient about the funding. And one more thing, what usually some candidates will do is, they talk about the reversal first immediately. They talk about the advantages of the reversal, and even before talking about the disadvantages, they talk about the funding and they say that it won't be funded. It will look blunt to the patient, and it will even increase her anger, because she's already upset with us, and top of that we are telling that it is not going to get funded. Don't do that. Talk about the disadvantages of the procedure and tell that it might not guarantee her conception also. Now if you talk about the funding, she will get convinced. Okay? And now talk about one important patient safety aspect which you should not miss in this particular task, is about ectopic pregnancy. Even if you conceive after the reversal procedure, there is a chance that the pregnancy can lie outside the womb in the tube. That's why if you miss your period, do come to the hospital immediately. Got it? So this is the way how you have to do this sterilization task. As I told you, there are a lot of things which you need to cover in the stipulated time, and this is an easy way to remember. In the information gathering, talk about mental history and the partner history also, why she wants to get the reversal surgery done, and what was the type of sterilization done earlier. Now take her through the plan of action. So what are the investigations? Involve the MDT, and what is reversal? Draw and explain about it. what are the advantages of reversal surgery, and why you don't want the reversal for her, that is about the disadvantages. After the disadvantages, talk about the funding. Now take her through available options, like she can go for IVF or adoption, and also you can talk about the age related changes of pregnancy, like increased risk of BP and FGR babies can happen. You can take her through these risks as well. And for the funding, be gentle and put her in touch with the GP and the clinical governing boards. And don't forget the important patient safety point, that is early USG if she misses a period to rule out ectopic. That's all. So try to remember it and try to form a structure regarding this particular task so that it will be easy for you in the exam to recollect.